Major funding for these programs is provided by the CUNY TV Foundation, Capital One Bank, Geneva Burns, Gian Tomasi and Webster, Chase Commercial Term Lending, Perfect Building Maintenance, the Witkoff Group, New York Community Bank, M&T Bank, Kilroy Architectural Windows, New York's Window Company, Greenberg Traurig, LLP. Additional funding is provided by Ariel Property Advisors, Bank of America Merrill Lynch, Bank Leumi USA, Briarwood Organization, Colliers International New York City, Cushman & Wakefield, Customers Bank, DDG Partners, Dime Savings Bank of Williamsburg, Eastern Union Funding, Flushing Bank, Friedman LLP, Herrick Feinstein LLP, Hersha Hospitality Trust, Investors Bank, James D. Kuhn Real Estate Institute at Syracuse University, James Orphanides Centurion Holdings, Margolin Weiner and Evans LLP, Madison Realty Capital, Massey Knackle Realty Services, Matone Group, Meridian Capital Group, Newmark Grubb Knight Frank, New Banks, People's United Bank, Popular Community Bank, RBS Citizens Bank, SJB Properties, Sterling & Sterling, Stonehenge Partners, Urban American, and These Friends.
Healthcare is so important in the nation, and healthcare is important in New York. And there are some leaders of healthcare who save people's lives. And I'm really fortunate to have Dr. Dan Roses, who is the Jules Whitehall Professor of Surgery and Oncology at the NYU Langone Medical Center, and also a professor at the NYU School of Medicine. Thanks for being here today.
Nice to be here, Michael.
So Dan, tell me a little bit about your parents and your grandparents. You know, there's an interesting history that goes back with Taft and Republicans and other situations and synagogues. So tell me a little bit about that. Tell me about
Where would you like to start? My grandparents?
your grandparents. Let's start with your
Okay,
grandparents.
so we'll start with the grandparents. On my mother's side, my grandfather came from Riga, and my grandmother from Germany. She came from a little town, Rodalbon, in Germany, and her father was the cantor in the synagogue in that little town. And my grandfather came here 1902, 1903. Theodore Roosevelt was the president. So as a result of that, as you've alluded to, as I was telling you, he was a lifelong Republican, very, very, very loyal Republican. On my father's side, my grandfather came from Odessa, my grandmother from Warsaw. My grandfather on my mother's side was in furniture wholesale, and my grandfather on my father's side was a tailor in the garment district.
Now, where'd they come to? Manhattan or Brooklyn or?
They all in the Bronx. And that's where I grew up, in the Bronx. My father was a dentist in the Bronx. My mother was a school teacher in the Bronx.
Now, you said to me that the Taft and the
No,
Teddy
but
Roosevelt,
he was such a loyal Republican that actually the middle name of my uncle was Taft.
right, and now your uncle was also
I had a granduncle who was very prominent in the family. He got here around then, went to DeWitt Clinton High School, and a very bright guy.
He went to Cornell.
And he was immediately went to Cornell Law School, and he was a major benefactor of the family, if you will, and a very important contributor to the cultural life of the family, and I was very close to him as well.
Now, you were telling me about your parents. How did your parents meet? You said
They met at a so I'm told, at a synagogue dance, and actually their brothers were friends, and their parents belonged to the same synagogue, and that's how they met.
Now your dad went to NYU School of...
He went to City College.
City College.
And then NYU Dental School. Yeah.
And what, your mother?
She was at Teachers College, and went on to be a teacher.
She became a teacher. So tell me about growing up in the Bronx. I mean, you were born not in the Bronx. You were born in Washington Heights.
Well, I that's what I.
That's what your sister gave you as the...
Yeah, and I assume that's right. I could check the birth certificate,
Okay.
but that was at the Jewish Memorial Hospital, I'm told, in Washington Heights, where I think our family doctor apparently had privileges. So that's where we were born. And but growing up in the Bronx was, I mean, that's where I went to school. And what I remember about the Bronx, I'd be in the schoolyard every day for a lot of. I don't remember. That's what I remember most vividly, being in the
Now,
schoolyard.
your dad's practice was up in the Bronx.
Yep,
also.
just, and I would be at his office very often in the evening. He'd practice all day and then a good many hours during the evening. And so I would very often stop in. At his office.
Now, you had a love for music also, right?
I love music, and I was also liked art. I mean, those are the areas that I was particularly interested in. And in fact, after junior high school, I went to the High School of Music and Art. And so these are great interests of mine, and they remain great.
What instruments did you play?
I can play. Oh, I play French horn now, and I continue to do that. Yeah.
So now, you finish high school, and where did you decide to go to college?
Well, it got decided for me. They accepted me at Columbia, and there weren't any profound decisions regarding that. My uncle had gone there. My sister went to Barnard, then Columbia Law School. So if you went from the Bronx to Manhattan, you were going out of town, as far as I was concerned.
It was
That
too
good
far
enough.
of a schlep.
And that's so it's certainly a distinguished school. I think you'll agree. And so I went to Columbia.
Now, did you always realize that you were going to go into healthcare or medicine?
I had some instinctive interest in medicine as well, and I think that may come indirectly from my father in a curious way. And I used to see him interact with patients all the time in his own way, and it was a very warm and meaningful relationship I saw developing there frequently. And on that basis, I suspected that drew me to it, that more than necessarily any great interest in biology, or although I was interested in science, but I think that, shall we say, that human element of medical practice is what attracted me.
So you graduate Columbia,
Right.
and you could have, Columbia had a great medical school, but you decided to go to...
It's not about it deciding. They, NYU was, curiously enough, we had a huge number of students from Columbia at the NYU School of Medicine, so far more than Columbia students at Columbia's medical school. And in any event, that's where I went, and I'm very glad I did.
Now, NYU School of Medicine started in the 18th century, right?
Well, NYU School of Medicine is really an amalgamation of two schools. The NYU School of Medicine was 1841. The Bellevue Medical College was 1861. And the Bellevue Medical College, very distinguished school, very distinguished, with very prominent physicians. NYU's was a great school as well. But in 1898, they merged for a variety of reasons. A number of the faculty, like a lot of mergers, it was somewhat of an acrimonious merger. And a number of the faculty members who were not pleased with this merger approached Cornell, and they said, Cornell's in Ithaca. Why should Cornell be in New York? But they approached Cornell. Cornell had a 2-year preparatory course in medicine, as many schools were, 2-year courses. You got a degree, you went to lectures. And they said, would you like to set up a school with more clinical, more prolonged curriculum and more clinical involvement? And so they said, sure. And that's how Cornell started at Bellevue. Cornell School of Medicine, that's why they're in New York. It was a result of a merger of the Bellevue Medical College and the NYU School of Medicine.
So you enter NYU School of Medicine, you're 20 years of age.
Yeah, just 20, yeah.
How do you make a decision that you knew that you wanted to get involved with cancer surgery?
Right. Well, for surgery, and I was in the honors program, and in the first summer, I went into the research laboratory of the Institute of Reconstructive Plastic Surgery, which was a transplantation research laboratory.
Let's talk about that, because that really has history going back to, many people think of Memorial Sloan, but in reality, NYU and this program came back from...
Well, regarding the surgery first, so that was a very academic surgical experience. I'm in a research lab for the Department of Surgery. And I see the surgeons who were there interacting with a very, very eminent group of immunologists who were at NYU at the time, perhaps the most prominent group of immunologists in the world at that time, including Benacerraf, who won the Nobel Prize. And they also collaborated with Jean Dosset on histocompatibility antigen research. And he went on to win the Nobel Prize with Dosset, curiously enough. And he was at the University of Paris. So I saw this very, very academic, very high power scientific collaboration going on. And so both the surgery appealed to me, because I just enjoyed that, seeing that and participating in my own way in the laboratory in that, and then that academic component of it. So it became both a exciting idea and a scholarly pursuit. And at that time, Dr. Spencer had just arrived. He was the chairman. He had just arrived in 1966, which is, I arrived there in 1965, and I started going to surgery conferences, and the whole thing became very appealing, so that I was set for that. Regarding the cancer surgery that you asked about, it's, NYU has a rich history in this regard, because the first devoted cancer service in the United States was the Skin and Cancer Hospital, which opened in 1883 in New York City. Memorial is at 1884. The Skin and Cancer Hospital ultimately became merged with the postgraduate hospital, which is now Tisch Hospital in a way. Postgraduate became part of NYU. So that, you know, in that era, cancer surgery was a very, very new phenomenon. You know, what we call the radical mastectomy was not described. It had been done before, but it had not been described in a meaningful way until 1894 by Halsted, who was at Bellevue before going to Hopkins, and by Willie Meyer in the same year, who was a surgeon at the Skin and Cancer Hospital. You know, the 1880s and 1890s saw the introduction of a number of major cancer operations, the mastectomy, as we know, that Halsted and Meyer described, being somewhat prototypic of the operations done in that era. So yeah, there's a long, rich history going back to that period of time. So for a variety of reasons, if you're asking me how I wound up in cancer surgery, when I finished my residency training, I had been involved in immunology research, and Dr. Spencer said to me he felt that that was complementary in a way, as it is, to work in cancer. And so when I went to the Navy, he said, when you finish the Navy, I want you back.
So you spent 2 years in the Navy as a lieutenant?
Right, I trained at NYU and at Bellevue, and then I spent 2 years in the Navy, and Dr. Spencer very generously told me to come back. And those, again, I didn't
But you know, I mean, over the years, you've written over 250 published articles. In this book you wrote, The Diagnosis and Management of Malignant Melanoma, and this textbook that you wrote on breast cancer a number of years ago. Besides being a surgeon, you've been awarded as the top teacher of the year. You're also very involved as a teacher. How do you think that comes out of the training that you had at NYU, or is it a combination of efforts?
No, I think absolutely, and I had good role models, and I think, you say, besides being a teacher, besides being a surgeon, that's part of being a surgeon. Surgery is a scholarly pursuit, and everybody knows that.
Since you and I remember the late Saul Farber, who was, I mean, he was there how many years at NYU?
Well, he was the acting dean when I got admitted to medical school, and then he was chairman and the professor of medicine and a very dominant figure in the academic life of NYU, and then was the dean.
Right, and the combination, I think, part of what people don't realize, that, you know, they hear NYU, but NYU and Bellevue and the VA were all tied together. And
yeah, they ultimately, and then, you know, Bellevue had divisions for Cornell, divisions for Columbia, and they eventually, Columbia and Cornell left Bellevue, so Bellevue became only, the visiting faculty was NYU. And when the new NYU Medical Center was built, it was built along the East River next to Bellevue, you know, and so that relationship, and then the VA was added onto it, if you will, so that really you had a half a mile of hospitals and a very rich teaching environment, if you will, as well as a great clinical facility for patients.
We were discussing your areas of specialty. that you above the skin is what we were saying, as opposed to certain people who do surgery, you know, in the stomach and other areas. Tell me about that.
That just evolved. Because this was an area, again, that Dr. Spencer felt he wanted me to pursue. Melanoma and breast cancer are very accessible tumors, and they've been prototypic for the study of cancer for a long time. Many of the, as I say, many of the operations, even to this day, evolved from treatment of melanoma and then treatment of breast cancer. For example, sentinel lymph node biopsy, which is a more direct and specific way of evaluating regional nodes that may drain a tumor. That started with melanoma and was adopted for breast cancer. So those are accessible tumors for study, and they are fascinating in and of themselves, but needless to say.
And what about
they can be devastating diseases and involve a lot of...
What about the thyroid and the parathyroid?
And the thyroid and parathyroid was just something I was, again, that was interested in, and parathyroid disease is a particularly fascinating area because it's rarely a malignant problem. It's almost invariably a totally benign issue, except for the fact that it can do some terrible things metabolically. And also it can be, a tremendous amount of good can be done to patients through a very small incision. It's really, in many ways, a model operation, relatively atraumatic, physiologically can have a profound impact on patients' well-being. So for a variety, these are the things I'm interested in.
Well, we were talking when we got together that, you know, the amount of time that a patient was in the hospital, the treatment, the personality, the relationship, how has it changed over the practice of surgery over the
Well, I think
past?
well, we discussing really had to do with changes that have to be made in education and curriculum, because although I'm not directly involved in setting policy in this regard, patients are in and out of hospitals much more rapidly for the most part. Much more is being done in the ambulatory setting at diverse locations, so the ability to educate students and residents has to shift and change. The paradigm for education is changing for that reason, so that the ability, the beauty always of surgery in terms of teaching was the student, surgical disease very often evolves very rapidly, and you can evaluate a patient and also bring the patient to do what you have to do surgically and see the resolution of that disease process in a more finite, predictable period of time. There's not as much chronicity of treatment and surgery, perhaps, as there is in other areas. So for students, that can be a very rewarding, and certainly for residents and for surgeons, a very rewarding experience.
Right, you were talking to me about the white coat. Something that you've been involved with over the years.
Well, I used to, many years I gave the white coat ceremony, yeah.
Explain to my viewers what the white coat means. I mean, I know.
Well, the white coat's a symbol of medicine, and so students entering medical school are given a white coat. It's at a ceremony. When you finish, you get a diploma, but when you enter it, they give them a white coat. And I was asked for a number of years to give the address to the entering students, and I very much enjoyed that challenge because it got me thinking really about the meaning of medicine and what these symbols mean. These symbols are symbols of authority, and they have great significance in the view of patients. But the white coats can be abused. The title of doctor certainly can be abused, and has been in history. And as I was commenting, and I like to remind them, when people arrived at concentration camps, many of the concentration camps, the first people they would meet would be physicians who would determine who would be immediately sent to their death. So that was the most perverse misrepresentation of the symbolism of being a doctor that can be imagined. And in a curious way, I think all of medical ethics ought to start with the study of that. Even today, we have a dictator in Syria who's a physician, and which is, has a medical degree, trained in ophthalmology, and then we hear about the terrible things that are going on there. So it has to be Obviously, it has to be earned.
You've run a variety of research funds, embryonic research funds, where you give you watch over the seed funding for certain
Well,
tests.
I think that medical research is extraordinarily expensive and depends on funding, but there are many pilot projects that can be begun that will bear fruit later on that can go on to more significant funding. And whenever possible, I try to raise and direct funding for those kinds of projects that can go on to more significant funding at a later time. And that can be, that's very rewarding because, if you're at a universities there really what makes a university medical center is both caring for patients first and foremost, but also you are providing knowledge to students and residents, and you're also creating new knowledge. That's what really how you define a university. So I think there's a responsibility if you're at a university medical center, a true university medical center, to pay great attention to those two aspects of it.
How has the profession of surgery changed over the years? How do you see surgery today?
Well, I think that I can speak to the specific areas that I work in.
In your areas?
Well, let's take breast cancer. That at one time, the paradigm for cancer treatment was clearly directed predominantly towards surgical treatment. And it was based on an incorrect assessment of how the disease spread, which was that somehow disease spread contiguously through lymphatic channels to lymph nodes and then went beyond those lymph nodes to other parts of the body. Many of the leading surgeons who set the major teaching examples for those surgeons who followed, Halsted in the United States, Handley in Great Britain, had this belief that there was this lymphatic permeation, and therefore if you could do a wider operation, a more extensive operation, you could encompass the disease more effectively and cure people. And to a certain extent, there may be examples but where that's certainly true. But if you look at Halsted's original papers, he talked about an 8-centimeter cancer, which is the size of a fruit, if you will, as being small. Very often a cancer like that would have involvement of lymph nodes, and it would be adherent to the underlying muscle, so that if you take that all out contiguously, if you will, you have the radical mastectomy. But that paradigm lasted for a long time and gradually shifted as imaging became better, mammography being one example. They couldn't evaluate for distant disease, so they assumed that it didn't exist, and therefore they treated patients with radical surgery. And then radiation became more effective. Chemotherapy was demonstrated to be effective at an earlier time, so the treatment became multidisciplinary. You could preserve breasts if radiation was administered, and you could also, if imaging could pick up things before they ever became clinically that significant, so that smaller operations could be just as effective. Where mastectomy, let's say, in breast cancer was needed, reconstructive techniques became better. So I would say that in this disease, the treatment has become far more multidisciplinary, and that requires surgeons to interact more and more with other medical disciplines.
And the same thing with melanoma?
To a certain extent, the same thing with melanoma, and the treatment has become much more specific. There was a time that the treatment of any melanoma was a very wide excision, but often removing all the lymph nodes that drain that area. But as we assess the prognosis more accurately under the microscope, and the surgery became more limited and less radical, if you will. And that term radical now is, at one time, it was viewed with great favor. We no longer use that word. In fact, we now use minimally invasive as the phrase that's often cited in a very positive way.
Let's talk a little bit about family. You met your wife, she was a nurse, right?
An obstetric nurse at Bellevue, and Helene Levy, and that's we met there, and we've been working, married for 43 years.
And she's with you in the office, too.
Absolutely.
She's your assistant.
Well, yeah, more than that,
She's that. And tell me about you have 2 sons and a daughter. Tell me a little bit about them.
My oldest son has a master's in film, and he's in the film industry. My middle son is a surgeon at the University of Pennsylvania on the faculty there.
And he's also
He does oncologic surgery, and a lot of it abdominal surgery he's doing now as well. And my daughter is a elementary school teacher.
And what about grandchildren?
We have 5, soon to have 6 grandchildren.
And their names? I mean, if you don't tell me the names of
The names of my grandchildren are Benjamin and Alyssa, Leonard and Josephine, and Ruby, and we'll see what the next one is named. I don't know yet.
Okay. And you've also been very involved, besides giving back, you've been involved with the temples in the community. Tell me a little bit about that.
Well, as you know, I'm a trustee at the Park East Synagogue, and I've been very involved there. And you know, that means a lot to me. It's very important. But and I think I had clearly there that comes from my family background. I know my father would be practicing dentistry, and the synagogue was 2 blocks away. And if they didn't have a minyan, he'd leave the office, leave the patients there, and make sure they had a minyan. And he'd be there every morning too.
You know, and as they say, you know, it's in your DNA. There are so many people who are so appreciative over their life of what you've done to help them save their lives, research, and more important, I'd say, the students. And I know specifically how the students revel that you've been there as the distinguished teacher, and there are many honors. And you know what? It's really important for the community, and I think the community of New York City and the community of the world has been very fortunate to have you around, and I appreciate for you being my guest today.
You're very kind. I've enjoyed it. Thank you.
Thank you.
Thank you so much.